My name is Kristen Richardson. I'm the public health nurse practitioner in Yellowknife. I'm also the regional public health officer for Yellowknife and our communities. So the cervix is an area that goes from the top of the vagina and the bottom of the uterus. So it's this spot right in here, and the cervix has a lot of cells in it that change quite frequently, which is normal. What we get concerned about is if the cells aren't changing properly and they begin to form tumors, and that's when you need to have screening for cervical cancer. Some signs and symptoms include having heavier or unusual menstrual bleeding, bleeding between your periods, pain during sexual intercourse, bleeding after sexual intercourse, unusual vaginal discharge, or unusual pelvic pain. So your first 3 Pap tests should be annually, and if all those 3 tests are normal, you will only need to have Pap testing every 2 years, unless there are recommendations from your healthcare provider stating otherwise. It's really important to have this testing done because it's really easy to catch cervical cancer early and to treat it. Pap testing is a screening tool that we use to check for cervical cancer. It's a very simple procedure. It's not very invasive. So the first thing usually happens is you come into the clinic for your assessment, you talk to your practitioner, and then you're covered in a gown and you get into the stirrups on the table. One of the tools we use is called a speculum. So this tool here is meant to go inside of the vagina and to help us to visualize the cervix and the walls of the vagina. So we cover it with lubricant to help decrease discomfort during the procedure. And we open it and you'll often hear a click, and that means it's locked into place. And usually you look through this part and you see the cervix on this side. And it usually only stays in for a few quick moments. And we use a tool which is the brush here. It's called a cyto brush. And this is what picks up cells of the cervix. And it just goes inside of the speculum, and we take a few sweeps to get some of the cells, and then we take it out and put it into a formula to go for examination at the lab. And then this closes, and then we take it out, and then it's all finished. After your Pap test is completed, we will take the sample of the cyto brush that you saw, and it gets submitted to a lab in Alberta, and they're going to look at the cells under a microscope to see if there's any cells that look unusual. Usually that takes about 5 to 10 days for us to get the results back. Based on those results, your healthcare provider should give you a call and let you know what your results say. An abnormal Pap test result does not necessarily mean that you do have cervical cancer. It just means that your cells are looking abnormal under a microscope. The doctor or nurse practitioner that you will be seeing will help guide you in what the next steps will be. Cervical cancer screening is a very important tool to help reduce your risks of cervical cancer related to HPV. HPV, which the long name for it is human papillomavirus, it's a virus that is actually very common. Over 75% of sexually active people will come in contact with it at some point in their life. And it's a virus that is linked to cervical cancer. Many of the strains, when we get it in our bodies, we're able to clear it on our own. But what we worry about are high-risk strains that don't go away and do lead to tumors that can cause cervical cancer. We do have vaccines for anyone aged 9 to 26, no matter what their gender is, because with HPV, they have found that there is still a risk of cancers such as throat, rectal, and genital cancers, and of course you can still get genital warts. It's a series of 2 to 3 vaccines depending on the age when you receive it, and it is funded by the territory.